Are you struggling to maintain control during intimate moments? As men age, particularly after 50, sensitivity in certain areas of the penis can increase, leading to intimacy ending sooner than desired. This is a common and natural occurrence that affects many men, but the good news is there are several proven ways to manage this sensitivity while maintaining pleasure and satisfaction. The penis contains thousands of nerve endings, particularly concentrated in areas like the head and the frenulum, which is the small band of tissue on the underside. These nerve endings send pleasure signals to the brain, but sometimes they can be too responsive, especially as hormone levels change with age. This increased sensitivity can make it challenging to maintain control during sexual activity. Understanding how sensitivity works is the first step to managing it effectively. When arousal builds up, nerve endings in the penis become more responsive to touch and stimulation. This process involves both physical and mental factors. Physical aspects include the density of nerve endings and blood flow to the area, while mental factors involve arousal levels and stress. Age-related changes can affect both these aspects, making the penis more responsive to stimulation. Many men feel frustrated or embarrassed about this increased sensitivity, but it is important to know that this is not a sign of any dysfunction. The body naturally changes as time passes, and just like other aspects of health, sexual wellness can be managed with the right approach. These changes do not mean giving up on a satisfying sex life. In fact, learning to work with these changes can lead to more fulfilling, intimate experiences. Some common misconceptions about penile sensitivity need to be addressed. First, being more sensitive does not mean there is anything wrong with your body. Second, managing sensitivity does not mean you will enjoy sex less. Third, age-related changes in sensitivity do not mean you need medication. There are many natural and safe ways to address this situation. Let us look at the science behind sensitivity and how it relates to sexual performance. During arousal, blood rushes to the penis, making the nerve endings more responsive. This is completely normal, but when sensitivity is too high, it can lead to difficulty in controlling the timing of climax. The good news is that this sensitivity can be managed through various techniques and lifestyle changes. The connection between age and increased sensitivity often involves hormonal changes. As men get older, shifts in testosterone levels can affect how the body responds to stimulation. Additionally, changes in blood flow and nerve sensitivity can make certain areas of the penis more responsive to touch. Understanding these natural changes helps in finding effective solutions. When these sensitivity issues are not addressed, they can impact not just physical intimacy, but also emotional well-being and relationships. Many men report feeling anxious about sexual encounters, which can create a cycle of stress that makes the situation more challenging. Breaking this cycle starts with understanding that this is a manageable condition with many practical solutions. One of the most effective ways to manage sensitivity is through physical techniques that can be practiced during intimate moments. The start and stop method is a simple but powerful way to build control. This involves pausing activity when arousal becomes too intense, waiting for the sensation to decrease, and then starting again. Over time, this helps train the body to better control arousal levels and extend intimate encounters. Specific areas of the penis respond differently to touch and pressure. The head of the penis, also called the glans, is often the most sensitive part. Learning to identify these sensitive spots helps in knowing when to slow down or take a break during activity. Have you noticed certain positions or movements that make it harder to maintain control? Being aware of these patterns is the first step to managing them better. Using thicker condoms can help reduce sensitivity without taking away pleasure. They create a subtle barrier that decreases friction and sensation, just enough to help maintain control. Special condoms designed for sensitivity management often include features like extra thickness in key areas while staying thin in others. Desensitizing products can also be helpful when used properly. Sprays or creams containing low doses of numbing ingredients like lidocaine or benzocaine can temporarily reduce sensitivity in specific areas. These products should be used sparingly and according to instructions. They work by slightly decreasing nerve responses in the applied area, helping to delay climax without removing sensation completely. Proper lubrication is another important factor in managing sensitivity. Too much friction can increase stimulation and make it harder to maintain control. Using the right amount of lubricant helps create smooth, comfortable movement that is easier to control. Some lubricants even contain mild cooling ingredients that can help reduce sensitivity naturally. Physical exercise focused on the pelvic area can improve control over time. Kegel exercises strengthen the muscles that control blood flow and muscle tension in the genital area. These exercises involve tightening the same muscles used to stop urine flow. Regular practice of these exercises helps build better control during intimate moments. The position chosen during intimate activity can also affect sensitivity levels. Some positions create more intense stimulation than others. Learning which positions allow for better control helps in managing arousal levels. Changing positions when sensation becomes too intense is a good way to extend intimate encounters while maintaining pleasure for both partners. Deep breathing techniques can help in moments when sensitivity feels too high. Taking slow, deep breaths helps calm the body's response to stimulation and provides better control over arousal. This simple technique can be used together with other methods to enhance their effectiveness. Lifestyle changes play a big part in managing sensitivity and improving overall sexual health. The foods eaten each day can affect how the body responds during intimate moments. Foods rich in zinc, like oysters, pumpkin seeds, and lean meats, help maintain healthy hormone levels. Omega-3 fatty acids found in fish, walnuts, and flax seeds support good blood flow, which helps with better control. Getting regular exercise improves blood flow throughout the body, including the genital area. This better blood flow helps in managing sensitivity and maintaining control. Simple activities like walking for 30 minutes each day, swimming, or doing yoga can make a real difference. Do you know that exercise also helps reduce stress, which is another factor that can affect sensitivity? Stress and anxiety can make sensitivity issues worse. When feeling stressed, the body becomes more reactive to stimulation, making it harder to maintain control. Taking time to relax through activities like meditation, deep breathing, or gentle stretching helps keep the body calm. This calmer state makes it easier to manage sensitivity during intimate moments. Like this video, if you're committed to improving your health, it helps us reach more men with vital information. Sleep quality also affects sexual health and sensitivity. Getting enough sleep helps balance hormones and keeps stress levels low. Most adults need 7 to 8 hours of sleep each night. Poor sleep can make the body more sensitive and reactive, while good sleep helps maintain better control. Cutting back on alcohol and stopping smoking can help reduce sensitivity problems. While alcohol might seem to help with relaxation, it can actually make it harder to control arousal and sensitivity. Smoking affects blood flow and can make sensitivity issues worse over time. Quitting these habits often leads to better control and more satisfying intimate experiences. Staying hydrated is another simple but important factor. Drinking enough water helps maintain good blood flow and keeps the body functioning properly. This includes sexual function and sensitivity control. The body needs about 8 glasses of water each day, more when exercising or in hot weather. Some supplements may help with managing sensitivity. B vitamins support nerve health and can help with controlling sensitivity. Magnesium helps muscles relax and can reduce tension that might make sensitivity worse. Vitamin D supports hormone balance, which affects how sensitive the body is to stimulation. Temperature can also affect sensitivity levels. Taking a warm shower before intimate activity can help reduce sensitivity by increasing blood flow to the whole body, not just specific areas. This more balanced blood flow often leads to better control. On the other hand, cool temperatures might increase sensitivity, so maintaining a comfortable room temperature is helpful. While many techniques can help manage sensitivity, it's important to know when to be careful and what situations need special attention. Some men might feel tempted to use too much desensitizing spray or cream in hopes of better results. This can actually cause problems by making the area too numb, which might lead to difficulty maintaining firmness or even cause skin irritation. The key is to start with a small amount and wait to see how the body responds. Certain health conditions can affect sensitivity and need extra care. High blood pressure, diabetes, or heart problems can change how the body responds to stimulation. These conditions might also require medications that could affect sensitivity. Have you noticed any changes in sensitivity after starting new medications? This is something worth talking about with a healthcare provider. Men who have had prostate surgery or other procedures in the pelvic area might experience changes in sensitivity. These changes can make some techniques more or less effective. In these cases, it's best to start slowly with any new method and pay attention to how the body responds. Some numbing products can cause allergic reactions in sensitive skin. Before using any new product on the penis, it's smart to test it on a small area of the arm first. Wait 24 hours to make sure there's no reaction before applying it to more sensitive areas. If any burning, itching, or redness occurs, stop using the product right away. Mixing different sensitivity management methods needs careful thought. Using multiple techniques at once, like desensitizing sprays together with thick condoms, might reduce sensation too much. This could make it hard to stay firm or reach climax at all. It's better to try one method at a time to know what works best. Being too rough during intimate activity can cause small injuries that might make sensitivity worse. Using too much pressure or friction, even when trying to last longer, can irritate the skin and nerve endings. This might lead to increased sensitivity later. Gentle, steady movements work better for managing sensitivity. Some men try to manage sensitivity by thinking about unpleasant things during intimate moments. This method can actually make things worse by creating anxiety and taking away from the experience. Instead, focusing on breathing and physical sensations helps build better control while keeping the experience enjoyable. Natural supplements need careful consideration too. Even though they're natural, they can still interact with medications or cause side effects. It's important to check with a healthcare provider before starting any new supplement, especially for men taking medications for heart problems or blood pressure. Remember that managing sensitivity is a process that might take time and patience. The body responds best to gentle, steady changes rather than quick fixes. Starting with one or two methods and slowly adding others as needed often works better than trying everything at once. The goal is to find what works best for each person's unique situation. Talking openly with a healthcare provider about sensitivity concerns is always a good idea. They can check if there are any underlying health issues that might be making sensitivity worse. They can also make sure any chosen methods are safe, especially for men taking other medications. Would you feel comfortable talking to a doctor about these concerns? Maintaining regular checkups helps catch any potential problems early. This includes checking blood pressure, blood sugar, and hormone levels, which can all affect sensitivity. A healthcare provider can also suggest specific techniques based on individual health needs and circumstances. Partners can be included in the process of managing sensitivity. Clear communication about what works and what doesn't helps both people feel more comfortable. This openness often leads to better results and more satisfying intimate experiences for everyone involved. Making sensitivity management part of a larger health plan works best. This means keeping up with exercise, eating healthy foods, getting enough sleep, and managing stress. These habits support overall sexual health and help any specific sensitivity techniques work better. Some men might need to try different combinations of methods before finding what works best. What helps one person might not work as well for another. Being patient while trying different approaches is important. The right combination of techniques usually becomes clear with time and practice. Remember that age-related changes in sensitivity are normal and manageable. Many men find that dealing with sensitivity actually helps them develop better awareness of their bodies and more control over their intimate experiences. This can lead to more satisfying sexual relationships over time. Keeping track of what works and what doesn't can help fine-tune sensitivity management. Noting which techniques, positions, or products are most helpful makes it easier to maintain good results over time. This information is also useful when talking with healthcare providers about any concerns. The most important thing is to stay positive and patient while working on sensitivity management. There are many safe and effective ways to handle this common concern. With the right approach and support, most men can find methods that help them maintain control and enjoy satisfying, intimate experiences well into their later years. Like and subscribe if you're committed to becoming the healthiest version of yourself. Thanks for watching.